I'm Dr. Pam Schaff. I'm the director of Keck School of Medicine's Humanities, Ethics, Art, and Law, or HEAL program. And it's my pleasure to welcome you to today's artist-patient event with our artist in residence, Ted Meyer, who I'll turn this program over to in a moment. And he will help introduce our guest. Our artist today is Susan Trachman, and he'll tell you a little bit more about her, and she will tell us about herself. I'm also really glad to welcome Dr. Andy Wu, who is a neurologist, and he is in practice in Santa Monica, and I believe has something to do with that other school across town, but we welcome you anyway, and gratefully. And just a word to say that today's event really is one in a series of events each year that it continues our school, our program's mission to align the work of artist patients with the core medical school curriculum and to foster enhanced understanding between patients and future health professionals. So our students in the first year are studying neurology now, and this is an opportunity for them to hear and learn about the lived experience of a person who is dealing with one of the conditions that they're studying. So with that, I'm going to turn things over to Ted and let him take it from there.
All right. Well, first, I will introduce Susan. So Susan is an MS patient, and we've known each other. We've collaborated on things for almost a decade now. She and what interests me about her and all the artists that that we show here is that her work changed drastically as her illness symptoms increased. So what we're going to do is look at her work. We're going to talk about how her illness influenced her work, and then our Dr. Woog will get to talk about. Well, first of all, he's going to check her knowledge of MS to make sure she's giving you correct information. And what I want to talk about a lot today is their relationship as a long-term relationship. And having been sick myself a lot, one of the things I always emphasize with the med students is making sure you pick the right specialty. And I really want to talk to them about, and the doctor especially, is how did he pick this specialty? Because this is one where he could end up being friends with Susan for 40 years and going to weddings and knowing kids and knowing grandchildren, and what sort of personality you need to be that sort of doctor. But first, I'm going to share the screen here. So I was looking online the last couple of days, and the last time we showed Susan the numbers of people who were diagnosed with MS in the country was about 490,000. And apparently there has been a new, and maybe the doctor can talk about this, there's been a new study done and maybe new way of defining what MS is, and it's up to 1 million. So maybe the doctor can fill us in on this jump in numbers in the last couple of years.
Yeah, the old data from many years ago was about 400,000, but the more recent data is more accurate. It is almost about 1 million patients. And basically about one patient is diagnosed about every hour of every day of every week in the US, a newly diagnosed patient with MS. And a lot of it is awareness, because people go to doctors more, they get on WebMD, look at their symptoms. And also people are coming forward talking about their MS, whereas before they weren't, for even in the media. So if you are a Sopranos fan, people watch Sopranos, people are downloading Sopranos. So, well, Meadow Soprano, Jamie Lynn Sigler, the actress, she came forward talking about her MS. So even in celebrities or even the media, people talk about MS more openly than they used to.
Has it encompassed more symptoms or anything now, or are they just doing a better job of finding early cases?
Yeah, just like with every new iPhone, that's more, you download things and they're faster. The MRIs are better now than when I was a resident at UCLA. We're detecting things more easily, things that we maybe weren't detecting before because the software is better. So not only is the technology better, but people are also more aware of getting checked out earlier too. Again, by just more knowledge about getting on, talking and getting on WebMD, and people are diagnosing themselves more and seeking help earlier and seeking treatment earlier too.
All right. So with 1 million people, sadly, you will never be lacking for patients in the neurology department.
That's right.
So this is we're going to start with talking to Susan here. So Susan had a show at UCLA about 10 years ago. And at that point, it was patient artist, and now you've switched it over to artist patient. And but we're using the same image to talk about this work. So let's talk a little bit about your health history and then why you've decided to show some of the same work, but switch the artist and patient positioning.
So I was diagnosed in 1988. I was 26. And I think I had symptoms earlier than that, which I think were actually MS. But my diagnosis came when I had a case of Bell's palsy, which is inflammation of the nerve in my face. And that led me to the doctor, which led me to a neurologist, which led me to an MRI, which led me to the diagnosis. Simultaneously, I was having some stiffness in my leg, but I, at the time and previously, worked out quite a bit, and I kind of attributed that more to my exercise. But the combination of all three led me to the doctor and the diagnosis. And fortunately, the Bell's palsy went away within about 2 weeks, pretty much untreated. But the stiffness did not go away, and over time it's changed. And I started out with a very mild case, a relapsing remitting case, and very, very slowly over these 30 years, my MS has progressed, and that's where I am now. When I did the exhibitor back 10 years ago, was patient artist, and actually the image on the screen that you're looking at, when I did the original image, the patient was on the left and the artist was on the right, and I flipped them because over the last, I would say 10 years or so, I've really identified way more with the artist side of me. I'm still a patient, not always patient, but I'm still a patient. But I am an artist, and I have used my art to express my feelings, things I'm going through, used it in many ways as my journey continues, which you shall see some of my work.
All right, well, let's do that now. So this is one of my, it's in a way, it's one of your more simple pieces, but it so explains how you adapted a lessening skill set to be able to do art with it. So why don't we talk about this one a little bit?
Sure. This one's called Order. And at the time, I had been taking Copaxone. And Copaxone is a disease-modifying treatment. I'm going to just call them DMTs to shorten it. And I was injecting medication every night. And initially, I had to mix the medicine with the saline. And then extract the medication out of the bottle and inject it. So part of my artistic process is saving my my bottles and other parts of my treatment. And these are the saline bottles. And I have taken them and I have used this box as a way to place them in an order and a pattern, which as I progress with MS, and even in the beginning, I can't control things. I can't control what happens to my body. And here I had the opportunity to be able to control every aspect of this piece. And I'm gonna segue back just a tad. I do have a design background, which I got from that other school. And I, being able to do this type of work is really wonderful for me, because it allows me to express myself and get and be creative. This one is called Balance. And I was experiencing a lot of difficulty at the time with my balance, and creating this piece, although it doesn't look like a lot, there's a lot going on. It took a lot to balance those boxes, and the pieces that are hanging from those kind of egg crate looking things are my bottles, and the egg crate looking things are the containers that the bottles were in the boxes when they came to me. So I try and incorporate incorporate my treatments within each piece. And there's a quote at the top of the box, which is, I'm going to read to you. Life is like riding a bicycle. To keep your balance, you must keep moving. And it just resonated with me on a lot of levels, physically and mentally.
Back to our doctor here. So you get MS patients, or I'm sure it happens with a lot of other neurological illnesses. People start to lose their ability. So let's say Susan was coming to you. She's found a way to express herself with this, but for the med students that are watching, how do you bring up the discussion of loss of mobility and balance and freedom and privacy, and how early do you bring that into the conversation?
Well, it's an excellent question. Every patient is different, and especially when somebody's first diagnosed, they typically might not know anything about MS. They think, oh, is this muscular dystrophy, the Jerry Lewis telethon? Is this ALS, Lou Gehrig's disease? What is MS? Because they might not know any neighbor or friend or relative with MS, so they really have no frame of reference what it really means. They may or may not have gone on the internet to read about it, so they're really coming in oftentimes with a kind of a clean slate, and it can be very terrifying. And I've been a patient, many of you have been a patient before, and so the biggest fear is not knowing. And oftentimes what we want to do is first give them some knowledge, give them some basis of that whatever journey we go on together, whether it's treatment of symptoms, treatment, as Susie mentioned, DMTs, disease modifying therapies that actually help the long course. We're going to do this together, and the journey is going to be full of different decisions we make together. So it's not insurmountable, and that there's information that we're going to learn together to do this. And so I think Susie hit upon something very important, and that is within the MS community, we always talk about, you don't let MS control you, you control MS. So you really change that narrative. You control the narrative, regardless of whether you're having balance issues or cognitive issues, fatigue is the single most common symptom in MS. Actually just being tired, even if you get great sleep, fatigue is the single most common symptom, not numbness, not balance, not visual things. It's actually just being tired. So whatever your symptom is with MS, then that you confront it and you try to control it in whatever way you can, whether it's medication, physical therapy, cognitive therapy, occupational therapy, medications, supplements. I do a lot of talks now these days about dietary things and the gut microbiome. I do whole grand rounds lectures talking about all the new supplements and dietary data that's very exciting, where people can actually empower themselves looking at, well, what is it about my diet, my lifestyle, my lack of exercise that it can literally impact my MS?
So do you try to get the physical and cognitive therapies in like immediately as soon as someone's diagnosed, or can you wait a while till they really start showing symptoms?
Yeah, it really depends on the person. I mean, a lot of times it's not even so much cognitive issues early on. It's just the stress of dealing with the diagnosis, and so sometimes it's more anxiety than it really is cognitive. But there are some patients who do suffer from cognitive issues with MS, and we address those as they kind of come up. So every patient's different with MS. Oh, I love this.
So
Yeah.
yeah, this is a great piece. And I'm going to start by saying these were not used sharps containers. When we hung this on the wall, we had to make sure it was not a biohazard. So Susan, why don't you talk about this one a little bit?
Okay, this piece has an interesting name, but it's called Java chip. But I'll kind of go back and explain that after I explain the piece. The number of sharps containers coincided with the number of shots that I had done over the years while I was taking Copaxone. And after each shot, there might have been a few I missed, but I would have a bowl of Starbucks Java chip ice cream, which is no longer made. And I happen to love coffee ice cream. Anyway, after having to do something like that every day, I wanted something to look forward to, because it takes a toll on you, and it takes a toll on your body. And these sharps containers may look random. They're not. They're ordered. And that is purposeful. And it's a reminder for me.
So what's the time frame? How many shots are we looking at here? How many years?
God, I have it all.
Well, if you find it, that's okay.
Yeah, I don't have it in front of me, but
Okay.
a lot. But I will get back to that.
Okay. Then let's talk about this one.
This piece is titled Chaos, and I went ahead and I created 3 individual pieces, which I put together. It's resin, and I chose the resin because it was clear, you could see through. And when I made each piece, I randomly tossed my medicine bottles in, and not all at once. I mean, I did it layer by layer to kind of create, so you could really get a sense of the chaos. And the pieces below are kind of remnants. But again, it was an opportunity, because at certain times I feel like my body is in a state of flux, and I've got a lot of different things going on. And this was a way that I could express it. These 4 pieces are a series called Living Color. And the first one on the far left is my actual brain scan that's not colored, which it's hard to see from this photograph, but it indicates there's some arrows on there showing the plaque caused by my MS. And, you know, as a patient, I've done numerous MRIs over the years, and I look at these scans and they give you information, but they don't really tell you who the person is. And I took it a step further, and I took my scans and I went ahead and I colorized them. Showing them on the light boxes was kind of an opportunity to say this is how one normally sees their scans. And I wanted to see the beauty and the color and the light, and I wanted everybody else to see that as well.
So this is a more recent, this is about a year old, this one.
Yes, so there's more to the story. Ted will show you another picture. That's the bottom portion of this piece. It's called Kaleidoscope. Those are all of my pill containers. And, you know, on a weekly basis, I load these pill boxes, and it's a tedious exercise. And I wanted to express the experience or in a different way. And I wanted to see in a different light. And honestly, since I've made this piece, when I do load my pill boxes, I have a completely different feeling about doing it. And as Ted will show you the rest, you'll see why. It also has, for those of you from the 60s, it has a little bit of a light bright feel. These pieces, these are pendants that I recently made from some of the images from the kaleidoscope. And I made them because I had the piece, but I wanted to be able to have it with me and share it with others. And the images are all made from my pills. And, you know, one would think you look at your pills in the boxes, it's pretty, you know, pretty boring. But I was able to take photographs of the pills, put them in a in a kaleidoscope type app and make images that were beautiful. And again, I'm trying to see the beauty, and it keeps me going.
All right, and this is your newest piece.
Yes, this is called Bottle Tops. So as Dr. Wu mentioned, along with the DMT medications, I also take a number of medications and supplements for my symptoms. And I started stockpiling all the bottles, and I decided to cut them up. And my plan originally was to do a piece with the bottom the bottom part. So I started cutting up all the tops, and the tops were so interesting that I ended up again placing them in an order. And I guess the thing that I find for me the most interesting about this piece is, and you can see from these two images, the different perspectives that you look at it, you see different things. And I think that's a metaphor for me. Depending on how you look at things, you see different things, and it's always good to, look at things from different perspectives. And I wanted to reflect that in this piece. And this is one of 3, 2 more to come, one with the bottoms and one with the middles. So stay tuned.
Okay. Before we get back to the art and Dr. Wu getting to be an art critic for the day, I want Susan to talk a little bit about, you had one set of medical care for like 14 years, and then that doctor retired and you had to find a new one. So this gets to my point of building relationships. So why don't you talk about what it felt like losing that long-term care, and then what you went through before you found Dr. Wu, and how you guys have built a relationship. And then, Doctor, I'd like you to talk about this specialty and these sort of long-term relationships you build up with your patients.
So I've been with my other doctor, Dr. Leslie Weiner from USC, for, as Ted mentioned, 14 years. And it was tough. It was really hard to lose my doctor, but I knew I had some advance warning. And I started kind of researching. I reached out to the National Society for Multiple Sclerosis to get recommendations. I reached out to my physical therapists to see if they had connections and patients who mentioned doctors that they really liked and worked with. My search was to find somebody who was going to be there for the long haul, please, who was knowledgeable about MS, and who had a good, if you will, bedside manner, personable, somebody who I could talk to, but also joke around with, and somebody who could see me as, yes, a patient, but also an artist, a person, a human being, and not just someone with MS. And I feel like I did a good job.
So what was it like to go in? You had to go through your whole history again. You had to build up, like you had to lay yourself out there for a new doctor for the first time.
Yes,
in years.
Fortunately, my MRIs travel well, so he was able to take a look. My file, I know he doesn't have it on his desk, but when it came to him, it was probably like this thick initially. So yes, I had to kind of go back in time and give him some history. And I had to trust, and I wanted to make, I had to trust that I made the right decision. And the other thing that I really wanted to find in a doctor was someone who was responsive. If I was having an exacerbation of a symptom, I could call, I could email, I could get an answer and not wait for days or, to get an answer. So that was really important.
So, Doctor, want to talk a little bit about choosing neurology as a specialty? I mean, did you think of anything else at other times, or and talk about this idea of building these long-term relationships with some of your patients? Because I always say that there's some people that are better suited to work in an emergency room, and people come in and they go out and they never have to talk to them. But you're as far from that as possible.
Right. So first of all, to be honest, I think Susie needs to be a little bit more honest how she chose me. Number one, she chose me because her husband's name is Andy. So my name is Andy. So that's really the main reason. We built a relationship. It's actually our 10-year anniversary. 2010 is the first time Susie came in. And yes, she came with her scans. So the MRIs did help. Dr. Les Weiner, I know very well. I interviewed with him when I was looking at residency program. So we go way back, and I'm good friends with all the other MS specialists at USC, Dan Pelletier and Margaret Burnett and Liliana Amezcua as well. So she was in good hands, I knew from before, and I'm happy to take the baton and try to help her out as much as I can. So to answer your question about neurology, I was not interested in medicine at all as a kid. There's a doctor who lived across the street who I thought was a nice guy, but just kind of too busy. When he'd come over for dinner parties, he was always on the phone in our kitchen answering calls from his patients. So I didn't really like that lifestyle. And then at the end of college, I was a music major and biology major in college. And then I was interested in doing research because I did a lot of research in college and was interested in doing a PhD. And then my mentor, big Legionnaires guy, and I was publishing with him, that he said, well, look, you can go into research either as an MD or a PhD. It doesn't really matter. If you like lab work and I like to cook, you could do an MD or a PhD, or you can do both. So I applied for an MD PhD program. So I did an MD PhD program. My PhD is in neuroimmunology, how the brain communicates with the immune system. And that's how we often explain, what is MS when people don't know what is MS. Your immune system is your antibodies, your proteins that stick to things, and your white blood cells that attack and kind of protect you from all the evil things out there. The viruses, the bacteria, the fungus, the Boston Celtics, all the evil forces out there, right? And what happens with MS is the immune system is too active. It actually attacks the covering of the nerve. So like, on a telephone wire, the covering of the nerve, the rubber coating is called myelin. And that's what shows up as the bright spots on the MRI scan. So one of Susie's great works, when you saw those 3 or 4 kind of radiology kind of things posted on the walls and those color pictures of the brain, one of them looked kind of like a Darth Maul kind of red one, but the one on the far left, the black and white one she mentioned, that MRI scan, if you were to look closely, you would see some bright spots. That's those bright spots she called plaques, the demyelination, the covering the nerve. So, so my PhD was in neuroimmunology, and then along the way, 3 of my good friends got diagnosed with MS. One from high school, one from grad school, one from medical school. So I kind of got into med school from my love of science, but also more so my hobbies, my interests. I'm a musician since I was a kid. I play jazz. I played a lot of classical, but mainly my love was jazz. So I did a lot of touring, jazz, funk, salsa. I played with Tito Puente, if you're a jazz fan. I played with Jerry Mulligan, Joe Henderson. A couple of my bands, 2 of my bandmates went on to win Grammys. I was the only one that ended up doing rectal exams and spinal taps, so I kind of went the other way. But I still play, and I still perform, and I still play clubs and that type of thing. And I did martial arts since I was a kid. And so I still am very active with martial arts and competed in college. So to me, neurology was the one thing that could answer those questions for my hobbies. How does the brain let people like my heroes, Miles Davis, Dizzy Gillespie, I wanted to name our kids Dizzy and Miles, but my wife kind of put the kibosh on that. But how does the brain create jazz solos? How does a comic, stand-up improv comic, or a jazz musician create a jazz solo just off the top of their head, a different solo with the same song every time, or an improv comic take lines from the audience or topics from the audience and create a joke or a scenario just spontaneously? How does the brain do that? So neurology was kind of that avenue. Same thing with martial arts, studying different types of martial arts since I was a kid in college, and now I'm doing different martial arts than I did when I was a kid. I'd have instructors who were 5 feet tall and 6'5", but they'd all have the same thing, and that was grace and crazy coordination, doing things blindfolded and things. And how does the brain, and particularly the cerebellum part of the brain, the cauliflower part of the brain, and back here, how does that control coordination and movement and fluidity? And when the cops pull you over and have you do finger and nose on the roadside, how does the brain do that? So neurology was the one thing within med school that to me was not only interesting from a creative standpoint, how does the brain create jazz improvisation, but also movement, but also is the one thing within medicine where you could learn so much just by talking to a patient, and the bedside exam where you have patients asking them questions and having them do things, and you think, oh, I don't have to reach for a scan or do a biopsy or do a blood test. I kind of know, is this something serious or is it something that is actually not serious? Just by having them draw a clock or having them put their hands together, doing these kind of things that look like, oh, what are these? Are these gang symbols? What are they? Well, these are spatial tests that involve the non-dominant parietal lobe to look at spatial function, which Alzheimer's patients have a lot of trouble with. Yes, they have memory issues, but these are spatial functions that Alzheimer's patients actually have a lot of trouble with. These are things that you can do at the bedside that don't involve a lot of testing. So neurology has all these kind of fun physical tests and questions that you could ask patients that you could actually diagnose them right at the bedside. So that's kind of a long answer to how I got into neurology, how I got into MS, and how I got into medicine.
So one of you guys, we've got some questions, but I'm going to ask one more first before I get to other people's. So why don't you guys talk about this sort of long-term thing? You guys are sort of a team now for over a decade.
Yes. So let's see, as things progress and have progressed, I've been able to kind of reach out to Dr. Wu and say, what next? What can I do? What can I take? And he can attest to this. I'm not willing to, I'm willing to look at the different medications that are out there and approved by the FDA and analyze what has the least amount of side effects and could potentially provide me with the most benefit. So he's been really good at laying out all the options and giving me the choice.
Yeah, I agree.
You can jump in.
There has to be a dialogue. I have to kind of know what Susie's goals are, what her thoughts are, and what her expectations are, because I can't just sit here and say, whoa, I know everything about this condition, you need to do what I say, and be very paternalistic. That's not a good model for healthcare. You have to have some kind of shared decision making. That way, she feels good about it, I feel good about it. I have to be open to her concerns that maybe I'm not aware of, both from a cultural standpoint, from a just an expectation standpoint, side effects standpoint, and cost standpoint. Sometimes things are somewhat dictated by insurance as well, so we have to kind of work within those guide rails and those side rails and those types of things as well. But there has to be an open dialogue.
I feel like over the past 10 years, it's been very easy to discuss these things. I probably actually meet in person with Dr. Wu maybe twice a year. And, I can come in and say, I'm feeling like crap. And he'll ask me to define what crap means, right? And then from there, he can determine how to help me, what kind of symptom relief might work best for me. And there's been plenty of medications he said, hey, try this or that. And I've said, I'm not comfortable using those. So let's try and find something else. And that, as Dr. Wu mentioned, having that dialogue and the back and forth has been the most important to me, because it's not take this or else, you know, and he's always given me other options that work for me.
So we have a question from Karen, who says she's not a doctor or a medical student, but she's interested in hearing how Susan's beautiful artwork and deeply evocative, thoughtful explanations help those who provide treatment to people to better understand the illness, which is exactly why the HEAL program that Dr. Schaff set up, because we both believe that storytelling from a patient side helps the doctor understand the patient better. So that gets to my next question for both of you. Susan, you can answer that. And doctor, if you could sort of talk about looking at Susan's artwork, does it give you, as a healthy person looking at it but understanding the illness, do you understand all her work? Do you see where it's coming from?
Honestly, it's a way for me, by doing my art, it's a way for me to kind of track my journey and address some of the things that I'm feeling along the way. And it's also it's also really allowed me to connect with a lot of people, as here we are, you know. I met Ted, as he said, almost 10 years ago. And from there, you know, I've met some amazing people. And I'm not saying that, you know, I'm glad I have MS, but MS has been a catalyst for a lot of things. And one of them is these connections. And also one of them is making this art. Prior to making art and being an artist, I was an interior designer. And I did a lot of work residentially and commercially. And it was very gratifying. But at a certain point, two things happened. One, I had kids, so I couldn't do as much work. And two, even as my kids got older, because of my MS, I couldn't be out and about running around with my clients looking, you know, for materials and doing as much. So I don't want to say I fell back on art, because it's always been a part of me, but it was something I could do on my own. And it was an expression, a way to express myself, both creatively and.
Doctor, you're an arty type, music, be it, but still arty. What do you see when you see Susan's artwork?
Well, I love not only the colors and the pop, but also the sense of order. Because again, with MS, you're trying to control the narrative. So sometimes your body, you wake up one day, some things aren't working like you expect it to, then maybe later in the day it does work. So that whole thing about letting you control MS and not letting MS control you, some of those things were so brilliant, especially seeing all those red sharps containers mounted, such order, such color, so bold, and knowing just, you know, those sharp containers contain hundreds and hundreds of needles. So when I look at, you know, Susie's chart, and this is, you know, we have paper charts, sadly, we're dinosaurs in our office, you know, we're on volume 7 of the Susie story on Netflix. And so the other 6 volumes are downstairs in the basement. So she was on this Copaxone, a daily injection from 1995 through 2008. So that's about 4,800, almost 5,000 daily injections. So that's about 5,000 needles scattered in those mounted red boxes. So just the sheer enormity and volume of thinking of yourself, well, you got a flu vaccine, maybe you got a COVID vaccine when you're a kid, maybe you got the polio vaccine, tetanus shots in the ER when you broke your ankle or something. But think of somebody giving themselves a daily shot, like almost 5,000 times, and for her to put that all in something visually pleasing in such order, but taking control of that, putting that in her body to take care of herself and her health, but actually using that to express that, hey, I got this. I'm doing something with this, and presenting to us in this kind of, to me, I'm Asian, so everything's a food analogy. In this buffet, this visually pleasing buffet, like, here it is. This is how I'm dealing with my MS. I think it's just I'm awestruck, and same thing with some of the other presentations of the mobile, just so beautifully, just the movement, the balance, and and as we were talking about before, whether it's movement issues, cognitive issues, numbness, tingling, fatigue, these things it's so beautifully reflected in what she's kind of proposed as the balance of this, your medication, your health, your family, balancing her career, your kids, your health. All these things kind of are reflected in what she's just expressed by the things she deals with, her pillboxes, her needles, her packages, and then the first of the three. I'm excited to see the other two, but her bottles for her symptoms now, and I think that her work in progress right now. So I'm excited to see what's coming up next.
Yeah, I always use the first one we showed, the order, when I give lectures, because to me it's such an easy to understand example of trying to maintain control of your life in a little square. It says it all. So here's one more question. We're getting right near the end of our time. From another MS patient who wants to know whether there's any sort of checklist that, so she knows what to prepare as she's going to transfer to a new doctor to make her life less stressful. Are there key things that she should be preparing for her new neurologist?
Sure. I think whether you have MS or not, or just being a patient with a new doctor, always come prepared with a list of questions. So I think it's great you've already taken care of getting your MRI scans, because every neurologist, we love the data. So you want to get we would like to see the MRI scans either on a CD, a little CD-ROM, or a thumb drive, or actually, if you have to bring the old films, we don't do that as much anymore. Every MRI center will burn a CD or put it on a thumb drive for you, or send you a link that the doctor can actually look at, because we like the reports, the written reports, but we actually like to see the films ourselves with our own eyes. But then come with your list of questions, like, all right, if you have concerns or questions about any medications you're on or any interactions, come with questions about your lifestyle. As you know, it's so important now to look at diet, exercise, and sleep as part of the cornerstone of your MS. I give whole lectures. I give these grand rounds, CME lectures. Again, being Asian, I call it the three culinary M's of MS: manja, microbiome, and molecules, because there's so much interesting data now with the gut microbiome and how it's different in MS patients, and what dietary supplements there are and what data there are. Why does your Chinese herbalist say you don't have to wrestle bear bile for their bear bile? There's, TUDCA, it's taro urso deoxycholic acid. It's a supplement that you can buy that you don't have to take a bear's bile and their gallbladder for. And there's actually data now in the MS animal model that's anti-inflammatory. So my buddy Pete Calabrese from med school buddy, he's head of MS at Johns Hopkins. They're doing studies with that to see if it's actually helpful in patients. But it's a supplement that Chinese herbalists love, because it actually decreases inflammation and decreases, and that rebalances the liver qi. So there are all these kind of things that, you can actually empower yourself. So those are kind of questions you might ask your new neurologist, as well as disease-modifying therapies. If you're not having enough effect, or if you're having problems with your disease-modifying therapy currently, or you have questions about new ones, there are now 19 different medications for the treatment of MS. As a resident at UCLA, there weren't any, and then there were a couple, and there were only injections. And now there are pills, there are IVs. So there's an explosion of research now of 19 different things to choose from.
Well, I am so grateful to you for making time to be with us today, and Susan for introducing us to Dr. Wu, and for sharing your story and your art. I've seen your work before when it was in the gallery, and I love the direction you're going, and I love the conversation that's allowed us to hear how the relationship between doctor and patient is so crucial. Dr. Wu, you're killing me.
Don't mess with the diesel. Don't mess with the diesel.
But,
I think we're all upset that we can't have bear bile though.
thank you to all of our attendees today as well, students and faculty and staff and family members and other community members. It's just great to have you part of this conversation and to you know, to highlight the work that we're doing in medicine and education. And it's just wonderful, Susan. I'm so grateful. Thank you again.
Thank you. Thank you for the opportunity. Really.
Thank you for inviting me, Susie. Appreciate it. And Andy, good to see you too, Andy. Andy Club.
Right. All right. Thank you all. And we look forward to seeing you at our next events. Bye,
Thank you.
everyone.